Okay, welcome to another episode of Washington Policy on the Go. My name is Donald Kimball. I am the communications manager here at Washington Policy Center, and we have got a good program today lined up. We're going to be talking with Elizabeth Hovde about the rescinded state employee vaccine mandate. Last week, the Inslee administration followed the federal government on that. So we're going to talk a little bit about the details, what that entails. And then we're also going to be talking to our Center for Transportation Director Charles Prestrud on the state of the funding of roads and, sort of the pothole that came up and what that signals more broadly about Washington's transportation budget and funding and all that sort of thing. So without further ado, we're going to go ahead and start with Elizabeth. So thanks so much for joining us today, Elizabeth.
Thank you.
So just so that everyone is, on the same page to start, why don't we go over this vaccine mandate for state employees that just was overturned? You've advocated for this to be overturned for a long time. Can you recap sort of how this mandate came to be and maybe some of the problems that came with it?
I can. Don't get bored. It's been a long, misguided path. All right. So in August of 2021, Inslee used his emergency powers to issue a vaccine mandate for state employees and healthcare workers. They needed to be vaccinated by October of 2021 to keep their jobs. So more than 2,000 employees who made the decision not to be vaccinated received pink slips or felt forced to quit or retire due to the mandate. State officials reported these numbers in January of 2022. You can look them up on the Office of Financial Management. Other reports show that the state's healthcare system lost about 3,000 hospital workers because of the mandate. And some of the state's first responders and healthcare providers weren't trusted to stay on the job that they'd been doing the past year and a half of COVID. Later, a federal mandate also was forced on some healthcare workers, the healthcare employees at Medicaid or Medicare receiving facilities, but we navigated the one here first. As a result of the governor's mandate, public and healthcare services suffered. We watched ferry schedules get altered. We watched roads go unplowed. The Washington State Patrol officers, many of the officers were let go, and doctors were sent packing in some situations. But even worse than seeing the workforce in Washington suffer for no demonstrable health benefit, careers were ruined and working families lost income. And many family, friends, and coworkers also remain divided even now after the government led its vilification campaign on unvaccinated people. An important thing to know about the mandate in our state is that by October of 2021, when the state employees were losing their jobs, we already knew that a person could contract and spread COVID-19, whether or not he or she was vaccinated. This is when I got interested in the vaccine mandate and trying to dismantle it, not because I'm against vaccines. They appear right now to be helping with severe illness and death for people, but I'm against a vaccine mandate for employment. It treats workers unfairly for no public health benefit. A vaccinated person can get someone sick or get sick at work, just as an unvaccinated person can. Before Inslee ended his state of emergency a year later in October of 2022, he issued a directive in August of 2022 that would keep the mandate on the books past the state of emergency. This is the employment vaccine mandate that is being rescinded. In that directive, back in August of 2022, the Office of Financial Management was ordered to do two things. They were ordered to continue the requirement for non-represented employees to be fully vaccinated, including any future hires, and they were directed to engage with labor organizations about keeping the requirements for represented employees. A permanent vaccine mandate was then written into law, and the requirement was placed in contract negotiations with unions. Again, this is the vaccine mandate requirement that was rescinded last week and that labor discussions will now go forward about. So I hope that gives you a good history.
Yeah. I mean, the most striking thing to me is how all of these decisions have seemingly been made after we have better information. And I'm not going to put you on the spot, but I remember at least there was some public disclosure request that showed that there was a gathering of people who had we're all vaccinated party. They had a party, and then from that party, it spread. So they realized, oh, you can still spread COVID, and that information was brought forward to the governor's office, and he still made these mandates knowing that kind of information, which is, it seems like they're operating either on bad or late information or just out of this sort of a political will to do this regardless.
Yeah, that was what was happening in the summer of 2021. There were these events that were happening that we found out we could all spread or contract regardless of whether we were vaccinated. And even with the information, it wasn't enough to stop it. And so exactly, that is why some people see it as a punitive requirement on state workers, not something that's for public safety.
Right. And the other thing that just infuriated me, but almost you have to laugh at, otherwise you'll go insane, was how so many, when we had the very heavy snows, so many of the snowplowers were, fired and then rehired on a contract basis where they didn't have to be they're not the same people, but they hired out contract people who didn't have to be vaccinated. So all it did was make snowplowing less available and more expensive.
Absolutely. It was ridiculous and horrible to our state workforce. And what you just mentioned, if you have a worker who's vaccinated and one who's not, firing them doesn't make them vaccinated. They're still in our community, going to grocery stores, living with their kids, sending their kids to school. So even at that level, it made no sense. And we know that elderly people are the ones who are becoming sick and dying. So even as that data became more prominent and more known, here we've got a vaccine mandate on working age people, and our workforce suffered. But of course, I'm more concerned about the fact that state workers are treated this way. These are people I pay. My tax dollars pay these people. They're our employees collectively, and they were mistreated, and I hate it.
So obviously the information that was new at the time didn't seem to impact the decision. So what seems to be the justification for overturning the mandate now, and how is it being done? In terms of, is that a full withdrawal of the mandate? Are there still incentives for being vaccinated? What does it look like in effect here?
Okay, so as you mentioned before, it's in conjunction with the feds. Inslee finally ended his vaccine mandate, not because both vaccinated and unvaccinated workers could spread and contract COVID-19, and not because of a suffering state workforce, but in conjunction with the end of the federal government's COVID-19 public health emergency on May 11. I think the mandate was getting too hard to justify to most people after it was even being dismantled on the federal level for healthcare workers. A May 1st press release from the White House announced that the Biden administration started the process to end its vaccine rules that it placed on healthcare facilities that receive Medicare and Medicaid, and a vaccine mandate on federal employees, contractors, and international air travelers would also come to an end on that May 11 public health emergency end date. So even though the governor is rescinding his directive and ending the employment mandate, he is allowing incentive pay for workers who are up to date with recommended boosters. That's an interesting wrinkle in all this as well. In the summer, in that directive of August, boosters were ordered. Later on, labor negotiations with the governor took that requirement away, and instead there was going to be pay $1,000 for each employee who chose to have a booster and be updated. And that goes into effect. You have to show that you're up to date after July of this year. And I think you have until the rest of the year. But at the time you show it, you have to be fully up to date. So whatever boosters have been advised for your age group or whatever. So that's what's going forward. And that too is misguided and does not follow the science. Taxpayers are going to be paying for boosters, even when the data and numbers don't show us that people fare better with boosters. I watch King County health numbers, and they show that with just initial vaccination, you're getting slightly better COVID outcomes than people with boosters. I think that has to do with the age of people involved. But again, data and science are not driving these decisions, and we're lucky the mandate on employment is going away.
Yeah, it's one thing if, you know, a particular individual who very strongly believed in this booster was paying his own employees, but this is a state entity, right? So the state needs to be making a decision that's responsible with taxpayer money, and so far the data doesn't exactly belie the that this is the best way to go. So I've got a couple more questions. We do have one from the audience that kind of leads into where I'm going next. So I'm going to give you this one right now. They're wondering if there is a breakdown of the 3,000 people who quit hospitals over the mandate, like whether, you know, what the breakdown would be between nurses, doctors, general staff, or do you know if any data like that exists?
There is some data like that, and I don't have it in my head, but I would go to the Office of Financial Management. I think it details it there, but I'd have to double check. And again, you're right. It included doctors, nurses, hospital workers of all kinds. So I know that I lost a doctor in the COVID mandate. She was my primary care provider. She is no longer working in the state as a doctor. So there were both, but I do know that the fact that it was all healthcare workers distorts kind of our view of that.
Mm-hmm. So because of all of these state employees that were fired, a lot of people I've seen asking if there's been any word about back pay or reinstatement or any kind of recompense for these people. And I know you wrote a blog about this pretty recently on this decision. Have you heard anything since then about any kind of compensation for these people?
I've heard there is no back pay, there is no reinstatement or retirement loss salvaging. The governor's office has communicated that if someone wants his job back, he can apply for an open position just like anyone else, which of course must feel like yet another slap in the face for these workers, especially the longtime state employees.
That is crazy. Essentially, you know, rescinding this vaccine mandate is tacitly admitting that you were wrong and it was a mistake to imply in the first place. You'd think that there might be a little bit of humility maybe in accepting the people who decided their own health decisions were their own and not the government's to make for them.
You would think, I get the hard job the governor had at the beginning of all this when we knew nothing. It was really frightening and you wanted to protect as many as people as possible. But where it becomes a problem is that, like we discussed, with more and more information, the mandate just got harsher and harsher and more strict and more unreasonable, hurting people.
So what then, talking about sort of the difficult decision making and stuff, what do you think state officials should learn from this policy and the outcomes? What would you say is the takeaway principle that can inform future decisions when it comes to, worker rights and state employees and, decisions for healthcare and things like that? Because like you said, that this can be a scary thing, and it's not as simple as just to say, in the future, nothing should ever be done necessarily. I mean, unless maybe that is the takeaway. I don't know.
I think the takeaway absolutely is that we should have learned to not make permanent policies and decisions when not enough is known. The governor made decisions that harmed workers and the state workforce for no demonstrable public health benefit. And again, the more and more we learned, the harsher the mandate became. An example of somewhere it was done better, I think, in our state was the State Board of Health last year was considering a school entry requirement that you had to have a COVID-19 vaccine to enter school. And they appointed a commission to help go over this and explore the idea. And several commission members who helped get the board to the decision that we saw, which was not to include a COVID mandate on kids, was that we didn't know enough to take the individual health decisions away from doctors, patients, and parents. Other people on the commission were concerned that it was simply too big of a burden to place on school workers to enforce. I'm not sure which one overrid the other or if they both worked in concert, but it was refreshing to hear commission members talk about, we just don't know. Even the people who are lined up to talk to them in these meetings, handpicked by the State Board of Health, I assume, said, we don't know yet. We don't know yet. We don't know yet how that's impacting them. We don't know how it's impacting this age group. So that's the biggest takeaway, that we do not make permanent policies and decisions when not enough is known. I think the governor, instead of an employment mandate relying on too little information, could have directed ways to accommodate worker decisions that work for both the state safety concerns and workers' health decisions. The other thing I think we learned is that we should be really worried about the government's ability to dictate the health decisions of its employees. I went after what authority the governor had to unilaterally make this decision without the legislature's input. And the RCWs and guidelines they pointed me to, told me that Inslee and OFM really have the ability to implement any mandate that they want. So they could say how much red meat a person can eat, how many drinks you could have during a week, or how much you exercise. That's just creepy. And I don't think they ever would use it that way. They never have used it that way, but nothing I saw in the authority to make this mandate would keep you from enacting anything that was thought to be for the well-being, public benefit of your workforce.
Yeah, well, with the way that some of these definitions get stretched, an emergency lasting over, 900 days and, a capital gains tax isn't an income tax. I do worry that sometimes people with, when they want something will use the law to its full ability where they're allowed. So, but the one thing I would say as well, another kind of example of this principle that you're highlighting, where it's, maybe make a temporary policy, and if it works out, we can make it long term, would be with the nursing licensure type restrictions being lifted during the COVID crisis, letting outside nurses get fast tracked to work in Washington. And now we've adopted the nursing licensure compact that works. So there are examples of policies that are temporarily put in, and then rather than being sort of removed or abolished because they didn't work, being adopted into being more permanent. And that's something else you've worked on.
That's a great point. And telehealth has been expanded as well in good ways that help all of us. And I think, when you're talking about the scary beginning of COVID and talking about a mandate, I mean, this one just went way too far. Even if you agreed that we should have acted before we really knew the data around vaccine outcomes, COVID outcomes according to vaccine status. Even if you did that, our governor didn't even allow for a testing opt-out. So unlike other states that had a mandate on their employees, they had a testing alternative to stay at work, or they were allowed more options for doing work in isolation from other workers. We did not do well on either of those fronts either. We had one of the strictest health requirements in the country, and it did not allow for a testing alternative. And the amazing thing to me along the way was you would constantly hear the message from the governor's office saying, trust your healthcare provider, talk to your healthcare provider, check with them. Well, I did that. She got fired, and she didn't get fired for telling me not to get a vaccine. And I am vaccinated, and I made the choice to get vaccinated even without that guidance at the time. But we were told to trust them, and then they lost their jobs when some of them said, you know what, I just need a little more information before I'm willing to endorse this vaccine for this age group. So I think there's so many lessons we've learned along the way, and sadly, I don't think we've learned them. I think that it just got too hard to justify with the federal public health emergency ending. And I'm thrilled the governor jumped on that bandwagon, because we've seen so many go by that the governor did not hop on and should have.
Awesome. Well, we have one last question, and this is a little bit broader, but it kind of highlights what you were talking about when you were reviewing the laws for the emergency. The question reads, if climate change was declared a health emergency, what is your thought about policy decisions that Washington officials may make? I mean, when you were reading that, did you think that could technically fall within there and they would have sort of broad authority under that as well?
That's super interesting. I do think that is a concern we should have. However, what the legal framework and the laws that I was looking with directly applied to the state workforce. So not the populace and what the populace can do. I was looking at the authority the governor has on the state workforce and OFM has on the state workforce. I'm really not sure about the answer to that question, but I think it is about.
I was going to say, I would imagine that if that was a concern, it would probably have more to do with emergency power declaration, something that our, Chris Corey or Jason Mercier could probably speak to a little bit more directly.
And I think along those lines, just the other day, I read an article asking if we should declare gun violence a public health emergency. And if we do, what are, emergency powers are brought here? We need to get the legislature able to intervene in any of these public health emergency or legitimate public health emergency situations. The legislature represents us.
Yes.
Look for someone to represent me. I want to be represented. And as you probably heard a million times, the lawmakers, they're a Democratic-led legislature. They might just go along absolutely with every decision Inslee makes, but they still need to be involved in the decision.
Right. Yeah. Well, and I think the fact that this vaccine mandate is being rescinded does show that, one man rule in a sense, or one person issued edicts do get rolled back and aren't always this infallible, wise decision making. So I think it's a great thing that it's been rolled back. Thank you so much for your analysis. And for anyone interested, make sure to stay tuned to the blog. Elizabeth is following this story and has updates every time I check, I feel. So thank you for your work.
And I should give one update now. We're hearing now from people in agencies or who are working for attorney generals or whatever. There are still vaccine mandates out there. There's just one that's been lifted off of state employees. So there are still government jurisdictions who are subject to a vaccine mandate.
Got it. Well, hopefully those get rolled back just like this one did. Thank you so much, Elizabeth.
Thank you.
All right. And next, I'm going to welcome Charles Prestrud, our Transportation Director, and we're going to talk a little bit about this, not specifically the pothole that arose, but maybe some of the issues surrounding it. So thanks for coming on, Charles.
Thank you.
So, all the media attention sort of last weekend and the week before was highlighted on this very visible pothole in Seattle on the Spokane Street Viaduct ramp. And you've highlighted that the city of Seattle boasted, sort of in response to this, about the number of pothole repairs that they've made. But you've also highlighted that that's somewhat of a misleading stat to celebrate. Can you elaborate on this and talk about that?
Sure. Yeah. The pothole, by the way, was actually on a ramp that's the responsibility of the Washington State Department of Transportation. It connects Highway 99, which is a state route, with Spokane Street, which is actually SDOT's, the city of Seattle's responsibility.
Got it.
But SDOT was saying that they had filled last year 23,000 potholes across the city. And that kind of raises the question, how do the city streets get in such bad shape to start with?
Yeah, exactly.
Because that's an awful lot of potholes. And the reason, of course, is that they haven't put nearly enough resources into paving and repaving streets for many years. And the result now is that you have a lot of old pavement that's breaking up, and anyone who travels through Seattle, I'm sure, has seen that. So they've sort of put themselves in a hole, so to speak. And the reality, of course, is that it is far more cost effective to keep the pavement in good repair to start with by having a regular repavement schedule. If you're chasing potholes all over the place, it means you're falling behind, and ultimately you're going to have to pay a lot more for a total reconstruction.
Exactly. So it's one of those situations where, foresight and preventative measures ahead of time can end up saving a lot more money and being, have a little bit more due diligence to start, rather than having to sort of play catch up with repairing all the potholes. So it seems like whenever there are people bringing up ideas of raising gas taxes or other kinds of tax increases, and anyone who opposes them immediately gets targeted and saying, oh, you're against, keeping our roads in good shape, you're against repairing them. But even when these taxes go up, we end up with potholes like this. So is there a particular reason that you see how the increased funds that are allegedly supposed to kind of go towards these types of issues, or at least initially they claim they will, how do those get diverted? How are our roads not being, is it all just misallocation of the funds, or is it a lack of revenue?
There's no simple answer. If you look around, you'll see some cities actually do a very good job. They make road maintenance a top priority. They budget for it. They keep after it. Unfortunately, there are other cities and even counties and the state that have a lot of different priorities. And it's very easy for them, it has been too easy for them to reallocate those funds to other places. In the case of the city of Seattle in 2015, the voters passed a $930 million transportation levy. And road maintenance was one of the things it was supposed to fund. And it did fund some street maintenance, but it also funded a lot of other things, bike lanes, transit improvements, safe routes to school, which is mostly pedestrian improvements around schools. And these are all good for somebody, but it didn't solve the fundamental problem that the streets were not being adequately maintained.
So I think I'll know the answer to this based on your answer here, but a lot of people would say that one of the ways that you could fix this would be a road usage charge, which was not adopted in this last transportation budget. What would you say to that kind of a claim?
Well, the proposal did come up. A bill was introduced in the last legislative session. It didn't get out of committee, and it raises a number of questions. The first one is, will the revenue be dedicated to road maintenance or highway purposes, or is it just going to turn into a big slush fund where the money gets siphoned off and used for all kinds of other things? Obviously, if that's the case, then you're not going to see much improvement in the transportation system. The other question that needs to be asked is, does the road user charge or mileage tax substitute for an existing source of revenue, or is it a new source of revenue that's going to be dedicated to transportation purposes? So there are tough questions that need to be answered there in order to really nail down what benefit would come from it.
So we've got a question from the audience I want to ask you here. We got the question: the state recently increased funding for maintenance and preservation of Washington's highway systems. Is this enough, or just slowing the rate of deterioration of this critical transportation infrastructure?
They are correct. In both the 2022 session of the legislature and in the session that just passed, the legislature found additional money, about $600 million in the coming biennium, for highway maintenance and preservation. This is a step in the right direction, but by WSDOT's own analysis, it is not enough to get caught up on preservation and maintenance needs. And in fact, the state's going to fall a little bit farther behind. So there's a lot more that needs to be done there, certainly.
Do you think that it is, again, because of the way that the funds are being allocated rather than the total amount of revenue being collected? Or is it an area where you could see a need for increased revenues in some way, as well as proper allocation and management of the funds to go into repair and maintenance?
Well, first, it is a question of priorities. And the State Department of Transportation and the legislature, as we know, have many priorities. They have a lot of things they want to spend transportation dollars on, much of which really don't have much to do with the condition of the state highways. Because they're starting from a deficit position in terms of the condition of the highways, there is a need for some additional funding. Where the money comes from is an interesting question.
Yeah. Well, is there any other notes that you have on this transportation budget that's passed? Is there anything to highlight in terms of oddities or maybe problematic areas? I know we've talked a little bit about some of the ferries and the funding that goes through that. Was there any update or changes there, or what are we looking at this transportation budget?
Well, it's a 260-page transportation budget, so there's a lot of funny stuff in there. And some of it is things like there's funding for a study of a fee on retail delivery services. So this would be, Grubhub and Uber Eats and conceivably many other services that are now delivered to people's home would be subject to an additional fee. Just funding for a study. It doesn't recommend that yet. We don't know what the study will conclude, but that gives you an idea of something that the legislature is very interested in looking at. Another interesting one is there's money in there to study what they call vertiports. So in the future, if you have vertical takeoff and landing aircraft, this would be a study of what ground facilities would be needed to accommodate that service.
Okay. How close do you think we are to the Jetsons' future then?
It's hard to say. The private firms have been spending hundreds of millions of dollars to develop these aircraft, and advances in electric motors and lighter weight batteries mean that they are technically feasible. That doesn't mean they're economically viable, though. That remains to be seen.
Right. The last question I have for you, and I didn't preview I was going to ask you about this, so I'm putting you on the spot here, but there's the issue recently you were talking with some folks on the new paid family medical leave law for rideshare drivers. I wanted to just get a little bit of overview for anyone who doesn't know about this. If you want to just highlight kind of what the implication of this, paid family medical leave applying to, Uber, Lyft, those kinds of services, what you think the effect of that will be.
Well, the law hasn't gone into effect yet, but it will pretty soon. And as you know, up until now, people who choose to drive for Uber or Lyft and some other similar businesses were treated as independent contractors. They were entirely responsible for their own medical care, and they weren't eligible for unemployment insurance and things like that. And the legislature has decided that even though they are still technically independent contractors, that the companies they work for have to provide unemployment insurance and make them eligible for the family medical leave benefits. Obviously, there is a cost associated with that, and the providers are certainly going to pass those costs along to their customers because they can't make a profit if they don't.
Yeah, and this is the will come into effect as the tax is being collected. Is that this July or so?
I believe so.
Okay, awesome. Well, thank you so much for the update on that and for your analysis. We really appreciate it. And we'll keep up to date with any other transportation stuff with you.
Thank you.
All right. Well, that's it for our episode today. Thank you guys so much for tuning in to Washington Policy on the Go. If you want to listen to this, share it with friends. We're going to upload this soon to YouTube. So make sure to catch us on there on our YouTube channel, or you can listen to this in podcast form on Washington Policy on the Go. You can find us on your favorite podcasting platforms. Thanks again, and we'll catch you in 2 weeks.